So I decided to do my research and devise my treatment program about generalized anxiety disorder in adolescents and young adults, particularly college students. According to the DSM-5, here are some definitions and explanations of generalized anxiety disorder. It is one of the most prevalent mental disorders in the United States among adults, with the prevalence rate being 2.9%. What distinguishes this disorder from non-clinical levels of anxiety are the intensity of the worry and its resultant impairment in functioning. And finally, pathological worry often is accompanied by physical symptoms such as migraine. This slide talks about the program based on literature. The two concerning factors that affect individuals with generalized anxiety disorder were the feeling of uncertainty and negative emotions. Risk factors for generalized anxiety disorder may be environmental and genetic in nature. Some risk factors include that females are more susceptible than their male counterparts, and if the child has a parent with this disorder, then they are more likely to develop it as well. According to recent literature, cognitive behavioral therapy tends to be one of the most effective treatments for generalized anxiety disorder, and I took this into account when planning my treatment program. This disorder is also comorbid with major depressive disorder and depression. So the treatment program that I developed is an 8-week program that is holistic and multicultural in nature, taking into account the culture of each individual, whether in the psychoeducational group or individual counseling. This program also emphasizes the wellness based on the biopsychosocial model, which incorporates all aspects into health and wellness, as well as a cognitive behavioral approach, meaning that individuals will have cognitive restructuring, which may provide a sense of control and in their thoughts, and also redirecting of negative thoughts. Also, there will be an educational aspect about effective coping mechanisms in reducing symptoms, an educational aspect about the prevention of generalized anxiety disorder, and additional workshops about coping with stress. There are several ways that I will promote this program, including the creation of a website that explains what anxiety is, how it can be managed, what prevention looks like, and some coping strategies. Flyers, brochures, and handouts will also be going around campus to destigmatize generalized anxiety disorder and also for advocacy. And also recognition of this disorder during Mental Health Awareness Week on campus will be crucial. Some financial considerations of this 8-week program will take place in the college setting, particularly in the counseling center on campus. And funding of this program will be via an educational grant that will also cover any additional workshops that might take place, and if possible, the university that implements this treatment plan may have additional funds in the student affairs arena to cover promotional costs. Some potential obstacles that we may come upon: it is not guaranteed that all students will fully attend all group and individual counseling appointments. Resources may be limited if funding falls short, which may result in a lack of attendance. And also, students may be hesitant to participate because mental health is stigmatized, which is why advocacy is so important. So, the program evaluation. It's important to use evidence-based practice in implementing this program. It is the highest priority so that we can better serve our clients and their needs. During intake, the brief symptoms inventory will be used as a checklist, um, as well as self-report pre- and post-assessment tests and screening tools, such as the Beck Youth Inventory for anxiety, and there's also one for depression. And because generalized anxiety disorder has comorbidity with MDD, students should also be screened for depression. Some future implications looking ahead. Generalized anxiety disorder and other anxiety disorders are often missed or not screened for by an adolescent's primary care provider, according to recent literature. Prevention and pre-screening may be used more often in future to discover any potential issues. Also, with prevention comes with the idea of coping with stress, some self-soothing techniques, and mindfulness, also guided meditation. Um, and then finally, increased advocacy and knowledge in the general public about generalized anxiety disorder may help normalize and destigmatize the disorder. And here are a list of my references. Thank you so much.